she's very close to me, that's a different reason. But if you look at her, she is very positive and she was an Air India pilot. Throughout her life, she has a very active life. 2001, she had a cancer breast and she was declared fit after chemotherapy, radiotherapy, surgery.
Again, I went back to flying.
And went back to flying also. So that means you see her attitude and zeal and all those things. And you can imagine a lady and flying and Air India, and she was very brave enough. Then of course, she had tuberculosis, okay. This part of it, she got treated. Now the biggest problem, in fact, in between also about a year back, you were admitted here and everything was fine. Fibrosis. There was little lung changes and fibrotic changes, but I declared it absolutely fine. But the real problem started because her sister is in America. Which part of America?
Massachusetts.
Massachusetts. And she's into a lot of doctor interactions because she's
herself is in the panel of a hospital.
Hospital, and she's a skill trainer, na?
She's a interpreter.
Interpreter. She interprets Spanish probably. Spanish interprets, that's why doctors, because she interprets and she needs all the good hospitals. Now what happened, she was enjoying her stay there and she was, which part of America you were in?
Gardner.
This was which part? Massachusetts. She was in Massachusetts. She called me from America that she's not feeling well and she was admitted. And she was so bad that she was into kind of a left heart failure presentation. And they declared in the record that she had a CCF, congestive cardiac failure. Okay, fine. They treated her and all those things, things are very expensive there. And she had a connection, she got it. Again she got a problem. It happened.
After a week or so, and at the same time in the night.
You just see. So that means the very important thing we have to discuss. As a pulmonologist, you have to understand why a lady who had such an exuberant career, a person who's been flying much ahead of others, cancer and other things are okay. It can happen to anybody. Why she went into a cardiac failure twice in America? What could be the trigger? That is the thing which should excite you. Now, in the report, if you see in an American report, what they have run, they have a tight mitral stenosis and all those things. I really didn't agree to that. When she walked into my office yesterday, a day before yesterday, I said, "You look fine, but definitely since you have an access, we'll evaluate you because it doesn't happen." She was very apprehensive. She didn't discuss with her husband and daughter. She came to me. I said, "Look, I'll just evaluate you." Now, what I find here that she does not have mitral stenosis. So first thing is that if American record saying that she has a mitral stenosis, so we should clarify it. Now, I just want to ask you, how a mitral stenosis, which is more difficult, a disease in the heart, mitral stenosis or regurgitation? Can you tell me? You said regurgitation? I put it this way. Mitral stenosis, mild to moderate, doesn't give you, but a tight mitral stenosis can present you with a left heart failure also. Is one of the presentations could be, but if mitral stenosis to go into a tightness at her age, and normally mitral stenosis in India cannot be isolated because the rheumatoid fever and all those things is obsolete. Hardly you don't get it. Even if you get it, usually the presentation is progressive. Rheumatic fever and mitral stenosis, what you have read in your books, that she doesn't fit into it. How old are you, Arunji?
I'm 68.
68. So I really didn't agree whether she has a mitral stenosis. And mitral stenosis also mild to moderate will not. So now the report says that she does not have mitral. So first thing is that you will check it up. Why in American record talking about mitral stenosis? We are talking about regurgitation. Both are entirely different things. Though this is the very easiest thing to pick up in echo. In mitral stenosis, you will get a fish valve or a tight valve. You can measure the valvula. Here they are talking about regurgitation. Rather, she fits more into regurgitation rather than mitral stenosis. Because somehow she has some LV dysfunction. Can this be a dilated cardiomyopathy? We don't know. Does she have some viral fever there, triggered LV dysfunction? So find out from her record, she was admitted before also. Where were you admitted last time here? आपके पास कोई आज से 2 साल 3 साल पहले का इको है?
जी सर है सर, 2014 का रिकॉर्ड है।
14 में है कोई? उसमें क्या लिखा हुआ है? LV dysfunction था? Because that is very important. When you are doing a clinical evaluation, don't you think a previous echo is also important? तो echo में क्या देखा था? Have you found? देखिए, if I read the American report, इसमें क्या लिखा है? In American report, mitral valve is grossly normal. There is a mild to moderate annular calcification, and there is now you see the better word. On one side, they are writing mitral valve is grossly normal. You see the language. On other side, they say the moderate mitral stenosis. How can you read it? On one side, you are saying this is normal. Other side, you say in a grossly mitral stenosis. with due respect to this better world, I don't agree. This is very.
And they told me it's a heart
Can
failure.
it, no, heart failure is a different thing.
I was quite shocked.
So that's why, is it some panic spell you had? Is it some hyperventilation you had? We don't know, because she was totally alone there. She went alone and it was around COVID time. So what I'm trying to say, we have to critically evaluate the heart. So refer the old echo records and find out what kind of LV dysfunction she had, whether the mitral regurgitation is progressing or not. So in that case, what do you like to do? Tell me, Akshay, क्या करना चाहिए ऐसे situation में? Tell me, she's a very young lady, she was a pilot, she looks fit, absolutely independent and functional. What is the test you should be doing it? Tell me. I would like us to do a T. One is T, very rightly. Second, why not stress echo? एक stress echo से पता तो चलो on stress whether she behaves abnormally or not. So stress echo is a test where we make your heart function do little more through drugs or through treatment. So do a stress echo and see the regurgitation behavior. नहीं करना चाहिए. So I think probably if she has gone into a recurrent cardiac failure there, then stress echo will demonstrate something, dynamic changes. Then also we can do some radio imaging studies of the heart also, two functional imaging studies of the heart. Don't you think we should evaluate it? So क्या करना चाहिए? The team what he will do it. इनका पुराना records में देखो echo में progressive changes है. If you find the echo में progressive changes, the first thing you should be doing after stress echo, we might have to do an angiography. We don't know. Maybe some progressive coronary artery disease probably disturbing her and she's going into intermittent angina or something like that. And that time probably she's going to be a failure. But she never had hair in India. Abhi you see, she's absolutely fine. That's why I'm doing a rhythm evaluation, get a thyroid evaluation. Other things, CTVT and other things you get it done because she has a little fibrosis. But more important, we have to do her dynamic cardiac evaluation. Don't you agree with that? So as he rightly said, Akshay, तो एक तो हम TE कर लेते हैं और दूसरा हम एक स्ट्रेस इको करके देख लेते हैं. अगर स्ट्रेस इको में आपको लगता है कि डिस्फंक्शन हो रहा है, फिर हम मूगा स्टडीज या नेडियोग्राफी स्टडी करके देख लेते हैं, फिर उसके बाद ऐसे ही होना चाहिए ना. You agree or not? Tell me, I'm right or probably if you want to give some other input. एक एक्टिविटी हार्ट को देखे तो सही कैसा बिहेव कर रहा है. Maybe when she is alone in America, she may be having mental health because alone she was thinking, हो सकता है कोई anxiety हुआ होगा, trigger कर दिया. Why twice she got admitted? Whether they mismanage the whole thing, it costs a lot of money when you suddenly visit a really congestive cardiac failure. Because if you see her heart function, even if you see her heart function, 40% EF is a very good EF. देखो 40% तो लोग ड्राइव करते हैं खुद ही, 40% लोग तो पहाड़ चढ़ जाते हैं. 40 में ऐसी क्या प्रॉब्लम है? और आपको भी पता है, echo is not a fixed number, it's a ratio. Does echo talk about the real cardiac function? No, it's a ratio. You calculating 40 ratio, contractility ratio है. तो मुझे लगता है कि ये सब करो, cardiac evaluation करो. Let's be aggressive. If you are a pulmonologist, let's use our brain. She may not be having these problems. ठीक है, that's why I'm, whatever I thought that whichever the patient we see, will make a video so that others also can understand our interaction. So this will be uploaded and tomorrow yesterday's start patient also will discuss. ठीक है, thank you.
मैं पूछना चाहती हूँ, what is a heart failure? अगर heart failure तो I shouldn't be alive. They said no, heart failure means your
तो एक evaluation कर लेते, ठीक है?
pumping, you know.
And so what we should be writing is that क्या क्या करना चाहिए as we discussed in the team. So one is that to evaluate for dynamic cardiac functions, हाँ? एक TE करो, stress echo, इतना तो करें, then probably we'll do a radio reflex study, हाँ? So continue statement, let her be here. At least you stay here for a day or so because this is your comfortable here. ठीक है.
As you decide.
So ठीक है.
I'm fully agree with you.
And एक बार evaluate कर लेते हैं तो कोई issue हो तो will be, because once you leave this bed now you will not get this bed also.
I know.
And once you are here you will be better monitored also. अभी आप बिल्कुल ठीक है, you just like a healthy normal lady otherwise. Let us evaluate it. Express echo करवा दो. ठीक है?
Stress echo, treadmill पे होगा.
नहीं हम dobutamine stress echo करेंगे. Let's do dobutamine stress echo. We'll give you a drug and do it. Don't worry, you don't have to do a treadmill. We'll do a drug-induced stress echo. ठीक है, ओके, दैट्स ओके.